everybody, it's Megan Jansen here with Employee Wellness Solutions Network. Today, we are going to be talking about how to optimize your heart health as part of the Christian Horizons Wellness Program. Hope you enjoy the next 10 to 15 minutes or so. And I hope you can send some of this information home to your families as well. Let's start with a little bit about the heart. First of all, as we know, it's housed behind the lungs and protected by our ribs. It's a muscle that's very busy. It pumps a lot of blood through the system. It takes a lot of waste away from the cells, and it cleans a lot of the blood before it gets back into the system. If I were to ask you to make a fist right now, make a fist. That is how big your heart is behind your ribs. Okay, housed right around the middle of the chest. It's essentially the weight of a ketchup bottle, between 7 and 15 ounces. Now, if we were to think about how efficient the heart really is and how much blood and how much it pumps in a lifetime, it actually pumps 2.5 billion times in a lifetime. That's equivalent to keeping your kitchen faucet running for 45 years. Turning it on and not touching it for 45 years. That's how much blood your heart is responsible for pushing through your system in a lifetime. Isn't it amazing? It pumps 100,000 times a day, 7,200 liters of blood through the system. That's equivalent to 1,600 glasses of water an hour, or over 38,000 glasses of water in a day. Isn't that unreal how the heart works? Well, some people think that the heart pumps like you would hold a stress ball. If you were to take a stress ball in your hand and squeeze it and then relax your hand and squeeze it and relax your hand, people think that that's how your heart pumps. In actual fact, it doesn't pump that way at all. It pumps in a way that squeegees out the blood as it pumps. Let me give you this example. Here we've got some towels, face cloth, hand towel, a little bit of a bigger towel, and a bath towel. If we were to take, let's use the example of a big bath towel, if we were to submerge it in this bucket of water and then start to squeegee out the water, it would be big, cumbersome, it wouldn't be comfortable, we'd be trying to fight with this big bath towel to get the water out. That's essentially how your heart pumps, but we want to have a small, efficient heart, not one that's big and overused and enlarged, because an enlarged heart is not healthy. We want to have an optimal size, healthy heart that does work when we need it to. So if we were to take instead the face cloth, submerge it in the bucket of water, and then squeegee out that water, that's going to be a lot more comfortable for our hands and a lot more comfortable with that size of material. So the idea is, just to kind of wrap this up, we want to have an efficient heart. And there's certain things we can ensure we know and do to ensure we have an efficient heart. So we'll talk about that as well. This particular photo just gives you an idea as to how efficient the heart and lungs actually work together. So the heart is a pump with 4 chambers. The upper chambers are called the left and the right atria, and the bottom chambers are called the left and right ventricles. And really what it comes down to is on the right side of the heart, so your right atrium and your left ventricle, pump blood. The blood pumps from the heart to the lungs. It takes up a fresh load of oxygen from your lungs, gets circulated through the system. The system then kicks back. Some of those pulls all of the carbon dioxide and all the waste that are out of the cells, takes it back to the left side here, brings it back into the lungs to get clean again, and then gets back into the heart for, again, circulation of healthy oxygenated blood. So as you can see, with this simple diagram, the heart is such a critical organ to ensure that dumps off of the carbon dioxide and waste and brings in some really healthy oxygenated blood. But we have to know how to keep our hearts efficient. And there are a few things in which we want to look at. Now, in terms of some of the concerns that come with heart health is through either family genetics or some poor lifestyle choices over time, that our hearts can actually get diseased. And this just gives you an example of a picture of plaque buildup that caused a heart attack. So the top picture gives you an idea as to how the plaque can build up in an artery, and the bottom picture gives you an idea as to what a healthy artery actually looks like without the plaque buildup. So what happens when we have that buildup of plaque and the buildup of that cholesterol that can cause some plaque is what happens is oftentimes this plaque can start to build up, which can form a blood clot. Now with the blood clot happening, it can then start to disallow that healthy oxygenated blood to get through to the system, which then causes muscle fibers to die. And that's how heart attacks happen. We get blood clot in the arteries, which is typically a buildup of plaque, and then that can cause the muscle to actually die, which is essentially the heart attack. Now, obviously, there are ways in which we can look at great opportunities to have efficient, healthy hearts, and which is the premise of today's few tips on how you can ensure that you have a healthy heart over our entire lifetime, starting from children right up until seniors. So the first one I'd love for you to try tomorrow morning is to test what your resting heart rate is. It's essentially finding your pulse, counting it, how many beats per minute your heart is pumping, and recording that somewhere. Now, the most normal beats per minute is essentially 60 to 80 beats per minute at rest. Now, the most efficient time, the best time to measure your heart rate is actually when you wake up in the morning. So tomorrow morning, when your alarm goes off, lie there in bed, find your pulse. You can find it on your wrist. You can find it just underneath your jawbone. You can usually find a really nice heavy pulse that way. However way you can do it, but then I want you to just count for 60 seconds. Keep an eye on your alarm clock, count for 60 seconds, and have that number handy. And do that over several days just to, again, see what your normal average resting heart rate is. You can even do it right now while you're sitting listening to me. Test your heart rate for 60 seconds and see if you are between 60 to 80 beats per minute. Now, here's a trivia question. What's healthier? A heart at rest beating 40 beats per minute or a heart at rest beating over 80 beats per minute? Well, obviously, we want your resting heart rate to be as low as possible. So some of the endurance athletes out there have very low resting heart rates, between 35 and 40 beats per minute, versus most of us are between the 50 to 70 to 80 range. So again, the lower your heart rate is at rest, the better. That is one way to really keep an eye on the efficiency of your heart, is testing your resting heart rate on a regular basis. The second way in which we want to ensure a healthy heart is to know as much as we can about what a healthy blood pressure is. Well, first of all, I'd love to go over some information pertaining to what blood pressure really is. If we were to think of your garden hose outside, you're probably put away now, but over the summertime, most of us have garden hoses out there. And if it's not turned, the water's not turned on, it's rigid, but it's not rigid too bad. It's more lucid. It's more of a, but as soon as we turn the water on, the water that's flying through that garden hose, it's essentially the same as your blood pressure. There's blood flying through our arteries, and our artery walls, there's certain pressure or force that's on our artery walls. And so it's a really great indication. A healthy blood pressure, well, I'll show you next slide. It comes with essentially two numbers, a systolic number, which is a top number, and a diastolic number, which is your bottom number. So when your heart contracts, it actually pushes or pumps blood out to the body. That's when it's working. It's going to be higher. When the heart relaxes, the pressure then will be lower in between beats. Then it pumps again. Then it relaxes. Then it pumps again. Then it relaxes. So when we go to the doctor, when we're at the drugstore, when we might even have a machine at home to keep track of our blood pressure, it's important to know what our average is at different time points during the day. If you're just getting off a really stressful shift or a really stressful time, your blood pressure might be higher than first thing in the morning or when you're ready to go to bed, as an example. So it's important to know how your blood pressure can fluctuate throughout the day. So overall, there are certain categories of blood pressure, and the healthy blood pressure is around 120 over 80. Most of us have heard of that the normal range is 120 over 80. In actual fact, if it's a little less than 120, it's fine. High normal is anywhere over 130, over 85 or so. High in the doctor's office, I want to put this in here because some people have a hard time giving their blood pressure in the doctor's office and being nervous to do so. And so oftentimes our blood pressures can skyrocket, which is typically an inaccurate reading. So the doctor may need to take it a few times to see how we can, again, practice getting your your blood pressure down to a normal level. Sometimes when you have a machine at home, it might not be calibrated as efficiently as one in the doctor's office when the nurse takes it, as well as if you are dealing with some form of disease like kidney disease or diabetes, you can have high blood pressure, which is 130 over 80 or higher typically. The doctor and medical staff can certainly provide information about this, and if you, there will also be lots of information on healthy blood pressure through the email campaign coming out this quarter as well. So stay tuned for that. The third thing I wanted to talk about is cholesterol, and I kind of like this cartoon. There's two types of cholesterol. There's LDL, which is the not so nice cholesterol, but it has a job, and the HDL, which is the healthy or the good cholesterol. So you see here the LDL cholesterol dumping in plaque, the HDL taking it away. Well, I'm going to show you a different example or a depiction of what cholesterol can do as well. This is how it works. And as you know, you might see this already or understand this already. I do like to share simple things so we understand, again, how this all works. So here we have a piece of drywall or sheetrock. It's 3 layers deep. There's a sheath, then the gyprock in the middle, and then an outer, another layer. It is exactly the same composition as an artery. If we were to cut it down, we would be able to see the 3 layers. Well, over time, poor lifestyle habits can cause what are called little nicks and cuts within our artery walls. It happens to everybody. And what it comes down to is if we were to take this drywall and just hammer it with little nicks, that's essentially what can happen to our arteries. Well, LDL has a job. It has a job to fill those holes, because if we didn't fill those holes, our arteries wouldn't function properly. So the LDL cholesterol comes and fills those holes. That's the putty that cleans up that. The problem is, though, is when we have too much putty or too much buildup like plaque, it can start to, again, cause heart disease, which can lead to heart attack and death, potentially. So the HDL is the actual scraper. It actually takes off that excess LDL cholesterol that was dumped there to fill that hole. We want our HDL levels to be efficient, so our scrapers are working the way they need to in order to take away the plaque buildup that can happen. And so that is how cholesterol really does work. LDL has a job, HDL has a job. So obviously the importance here is we want to ensure that our lifestyle habits are indicative of healthy ones, so we can ensure that we have appropriate levels of LDL and then appropriate levels of HDL along the way. So let's talk a little bit about heart disease prevention. So there are certain things that we can think about when we're talking about preventing heart disease. And this goes for families, children, adults, seniors, college students, is we want to start as early as possible with healthy habits. So eating fruits and vegetables, those beautiful, fibrous carbohydrates are so critical to our blood health, circulatory system, healthy levels of LDL and HDL cholesterol, etc. The efficiency of our hearts really are indicative of a plant-based diet. So we really want to ensure that we have enough of those during your day. We want to achieve and maintain a healthy weight. There is some research to indicate that about a 5 to 10% weight loss, should you need to lose weight, can reduce your risk of stroke and heart disease. That's a really great number. We encourage people to manage their diabetes, take the medications as needed, obviously, reduce stress and keep that as a daily practice. So what do you do every day to reduce your stress? Do you walk? Do you read? Do you breathe? Do you deep breathe? What do you do to try to reduce your stress throughout the day? And then the 5th one in this page is visiting your doctor regularly, keeping up on your regular physical visits to ensure that you are doing everything possible to stay as healthy as possible. Some other factors: be smoke-free, be physically active, at least 150 minutes a week. Now, some people look at that number and think, oh my goodness, that's a lot of working out. But if we were to take your 30 minutes a day or so and break that up into 3 10-minute bouts, it's exactly the same amount of exercise a week. So split up your 30 minutes a day. Split those up into 3 10 minutes or 2 15-minute opportunities to get some movement in. And you can also keep track of keeping track of steps and minutes of exercise as well. You want to know and control your blood pressure. I love to explain or suggest people to know your numbers. It's really important. You want to keep your salt intake low. 1 teaspoon of salt is 2,300 milligrams. So if you are a salt eater, nighttime dinner, and you're adding salt to your foods, 1 teaspoon is 2,300 milligrams. The upper limit is 1,500 milligrams. So we are really suggesting that we watch how much salt we take into our systems. There's salt in, unfortunately, every food out there. So the more salt that we add to our food after the fact, the higher our risk is to have higher blood pressure. It can cause blood pressure increase. So keeping your salt intake low is really important. Another great tip is to increase your potassium in your diet. Foods that are like leafy greens, potatoes, different types of dairy products are also high in potassium. Spinach and tomatoes, avocados are also really high in potassium. So keeping your potassium levels at a higher level can also help negate the effects of an increase in salt intake. So another really great example of that. Finally, on this particular, these few examples of reducing your risks is eating a healthy diet that's low in saturated and trans fats, but high in unsaturated healthy fats. And things like fish oil, walnuts, avocado, chia seeds is another one, hemp hearts is another one, some really great flax and flax oil is also a really great example of unsaturated healthy fats. And having a little bit every day is a really great example of, again, staying ahead and staying proactive when it comes to your overall heart health. Really great example. Here are some heart-healthy foods that I thought would be really fun to share. So for heart disease, focusing on lean poultry, orange juice is high in potassium, pomegranate as well, some red wine in moderation, salmon, skim milk, tuna, vegetables, and water. All of these are healthy for us regardless. Avocados, bananas, beans, dark chocolate, at least 75% cocoa, fish. And one of the recommendations for fish is having 3 servings a week, which some of us may or may not get. Flax oil, potatoes, skim milk, spinach, sunflower seeds. You can kind of see how there's lots of different examples of foods here. And for cholesterol, apples are in there, and also pears is another one that are high in fiber. And the fiber in the skin of apples and pears can actually help keep control of the cholesterol buildup. So that fiber is really, really powerful. Same thing with beans and oats. Beans and oats are power foods for lowering cholesterol levels because beans and oats soak up water. And when they soak up water, they turn into a mushy consistency. And this mushy consistency helps us eliminate some of that LDL cholesterol as well. So really great for lowering cholesterol levels. Brown rice because of the fiber. Cinnamon is another really great thing to have for heart health. It also keeps our blood sugars in check. So cinnamon is a great thing to have. Garlic, of course, grapes, nice fibrous skin on grapes. Salmon, walnuts, very high in omega fats, and whole grains. So again, lots of different examples of healthy foods that you can certainly consume and share with your families. The last point I'd love to share with you, and to keep this particular webinar at a point here where there's lots of information shared, lots of different takeaways you could ideally learn from today. My suggestion or my goal for you is to think about one nugget. I call it a nugget. Think of one nugget you learned today that you're able to take home and start tomorrow. What one food item that you'd like to try. Drink a bit more water potentially. Maybe get a bit more exercise into your day. Book that doctor's appointment. Get your blood pressure checked. Know your numbers. Get some blood work done at the next doctor's appointment. You have the power to do something. What is your takeaway? Thanks for listening today, everybody. I really appreciate your time listening to the information. If you have any questions at all, please direct them to Yvonne, and she will be collaborating and working together with the wellness program, and we're happy to share some of those answers to some of your questions you might have. Have a great day.